Broadcasting live from the Newsmax studio in New York City, here is Steve Malzberg.
And welcome back. You know, with all the scandals and day by day, it's something else. When's the last time we really took a hard look at Obamacare? Obamacare, do a Google search. It's practically out of the news and has been for quite some time. And that's not necessarily a good thing because the problems persist. The numbers of people who have enrolled, first-time new enrollees, way down from expectations. Costs continue to go up. Premiums continuing to go up. And hopefully the Republicans won't give Obama a pass on this going forward. Here's a woman who joins us now, who I've talked to many times, president of the Pacific Research Institute and healthcare policy expert Sally Pipes, who I know you won't let that happen. Great to see you.
Great to see you.
Thanks for coming in.
Yes.
All right. So you know it has been out of the news, pushed aside by everything from Iraq, and of course now you know with the IRS testimony.
Right, yeah.
But there is a tie into the veterans scandal, I believe. Why don't we start there? And many people have said that what we're seeing with the veterans, the waiting to be seen and the deaths as a result, is just a preview of what we're going to see for the entire population.
Right, and as you know, Steve, I'm originally Canadian, and so you know, long waiting lists, ration care, and I had predicted when I did a Senate help testimony that you know the VA system is an example of what has happened in Canada. But of course, people didn't believe me. People like Paul Krugman, oh, the VA system is single payer and it's fabulous. And then about a month later, all these scandals broke, and you know, I think it's a microcosm of what is going to happen to our healthcare system if we don't get it back on track and get away from Obamacare, or get away from allowing the federal government to take over our healthcare system.
And you know, we've talked about the death panels and your horror stories of the Canadian system with your mom and you know being left in the hall and not being able to see a specialist and all these things that people they don't want to hear about, or they say it can't be true. But with the veterans now, there's a whistleblower came forward the other day who said that even now, even fairly recently after the revelation of the scandal, numbers were being fudged to misrepresent the number of people who died in Phoenix while waiting to be seen.
Yes, exactly. And Senator Coburn came out with a report today saying there have been 1,000 needless deaths because of the VA and the waiting times. And you know, I just think that it's a microcosm because I believe the president really his long-term goal is not what Obamacare is, but it's to go to a single-payer Medicare for all. And he'll say, well, you know, we tried the competitive marketplace, it didn't work, therefore we need single-payer. And you know, we'll have the same problems they have in Canada and England: ration care, long waits, lack of technology. And what about the pharmaceuticals and the biotech industry, which people come from all over the world? We're the innovators.
I was going to say innovation stifled.
Absolutely. And so I think it's disappointing that a lot of the members of the GOP are afraid to talk about Obamacare. I don't know why. They need to raise it for the election this fall. It's huge, and we have to stand up and be counted on it.
Yeah.
53% of Americans still today would like to see this legislation repealed and replaced. So let's look at what the American people think of it. They don't like it, and as you say, 8 million people enrolled, but a lot of them haven't paid their first month's premium. They're absolutely astounded when they find out that the doctor they had before isn't available to them.
Or that they have this huge deductible.
Right, the deductibles are way up, and they're thinking, I have to pay that out of pocket, you know, before I reach, you know, being
right.
helped.
Youngsters who were you know talked into buying this, however many did, you know, that for less than a cell phone bill or whatever,
right.
And then if they got to go to the doctor, they're going to have a huge deductible, so they're going to get a bill, and they're going to call up and say, "Well, I'm covered," and they're going to learn what the meaning of deductible is for the first time in their lives.
Right, and to pay on average $340 a month for health care when they're young invincibles, they want to have the type of coverage for catastrophes and things. They don't want to be paying $340 a month, and so that's why, you know, the HHS had said that they needed 40% of the young invincibles, 18 to 34-year-olds, to sign up for Obamacare, and they only got about 25%. And most of those people are young people who have real problems. So it's a real strain on that system.
It's not cost effective.
Right.
Now, Cheryl Atkinson came out with a story yesterday, formerly of CBS, saying that I think the administration had expected well over 20 million new first-time sign-ups for for health care,
Right.
and what they have is more like 4 million first-time signups, and nobody's talking about that.
No, and I mean, the administration kept saying, well, we'll have a full universal coverage. Everybody will be covered. And in fact, the CBO came out and said that 30 million Americans by 2019 will still be uninsured. So the signups, it's not a good deal for the American people, Steve, and that's why you're seeing, no lack of sign-up.
You've written a piece recently in Forbes, at Forbes.com, talking about how the CBO admitted that it has no idea what Obamacare will wind up costing the taxpayers.
Right.
I mean, isn't it incumbent, and you alluded to the Republicans, what should the strategy be going forward? First of all, they should, as you did through your piece, they should make the public aware of this.
Right.
They should. I know there's other things going on, and Boehner today said he wants to sue the president for various things, but they should also hold a press conference talking about the revelations that come out every day about Obamacare, and they're not. But you did a great job with your piece and other pieces. So what should the Republican strategy be going forward? Repeal? Should they come up with there's a fight within the party?
Yeah, right.
Should we present our own plan, or just
right.
leave well enough alone and just run on the fact that people don't like what we have now and just let that be enough? What do they do?
Well, I think we need repeal and replace. That is, if they start by just repealing little bits of it, then you'll have, if the Republicans get the presidency in 2017, they've got to go for repeal and replace. Otherwise, you'll have these incremental changes, and before you know it, we'll be at single payer. So they have to, and Senators Burr, Coburn, and Hatch have a plan. Steve Scalise at the Republican Study Committee had a plan.
The new majority whip.
Right. And Paul Ryan has had a plan. Dr. Tom Price, they've had plans. The Republicans need to rally around one plan, not have all these. They're slightly different, but get together and tell the American people what it is that they're going to do for them to achieve affordable, accessible, quality care. Changing the tax code so that employees don't get a tax advantage, whereas individuals don't. Let's allow people to buy coverage across state lines. Medicare and Medicaid are going to be bankrupt. The CBO and the Medicare trustees have said we can't. It'll cost $1 trillion in 2023, and we need to. People live to 79. They don't die at 65, which was the age when Medicare and Medicaid came into being.
Right.
And so they've got to rally around a plan, and the American people don't like it. Let's get the American people educated on what's wrong with it.
Well, this is your first appearance with us since we've been fortunate enough to be on DirecTV and Dish Network, and I want to make sure that the people who might be listening to you for the first time hear the horror story. I mean, I hate to make relive it, but the way I became aware of Sally Pipes was I read a story in the New York Post way back maybe 07, 08 about the Canadian system and your horror story regarding your family member, and I got in touch with you, and we've been talking ever since. Tell me again what that was all about.
Right. So in 2005, my mom, I lived in San Francisco then, but I'm a Canadian. I'm an American now. But my mom had called and said she thought she had colon cancer, and I said, well, you'll have to go to the doctor. So she went to her primary care doctor. You don't call up a specialist in Canada under the single payer. You have to go to your GP. And he said, she went and he sort of felt around her stomach and said, well, I don't think you have colon cancer. And so he ordered an X-ray, and of course nothing showed up. And I said, Mom, you don't detect colon cancer with an X-ray. You need a colonoscopy. So she called back. She wanted me to do it, but I told her she had to do it. And he said, well, because of your age, you're over 65. We have all these people on the waiting list for colonoscopies, 6 to 8 months. We can't get you one. So by November, my mom had lost 30 pounds, and she called on a Sunday and said, I'm hemorrhaging. I knew I had colon cancer. We got her to the emergency room. She spent 2 days in the emergency room, 2 days in the transit lounge waiting for a bed in a ward, and she died 2 weeks later from metastasized colon cancer. Now, she did get her colonoscopy in the hospital. They determined that it was metastasized. But, it's cheaper to ration care and let people die rather than do expensive surgeries. And particularly for our older people, for seniors, we're going to see more and more of that. And I think that seniors in this country need to stand up to Obamacare, because when you take out $750 billion out of Medicare to help expand the Medicaid program, seniors are going to be hurt. 1 in 3 new Medicare patients can't find a doctor.
That is such a horror story, and what struck me is not only the age factor, that they wouldn't put her move her up on the list even though she had symptoms, because there's so many younger people waiting for a colonoscopy, but waiting for a colonoscopy. I mean, here they urge you. I mean, they beg you, come get your colonoscopy. Did you have a colonoscopy? Get your colonoscopy, and you could get it like that.
Right, and I've had 3, and because I have colon cancer in my family, and I'm so grateful, and I don't mind paying for it because it is so important to my long-term health.
Well, I mean, if you're insured, most insurance cover that.
Yes,
they want to cover it. They want you to have it every 5 years when you hit 50.
Right, because that reduces their costs.
Sure, but that's the danger of I had Tom Daschle on real quick here. We only have a minute. When he wrote his book several years ago, and he was supposed to be the architect. He was supposed to be Kathleen Sebelius, but he couldn't get confirmed.
Right.
Anyway, I said, 86-year-old guy, what would you do with him if he needed triple bypass? Give him a pill or put him in a hospice. That's the mindset, and America does not have that mindset, and people have to understand that.
No, we want people to have choice, and families and doctors should make those choices, not government bureaucrats like Berwick and people.
It's a conversation we better have fast. Sally, great to see you.
Thank you so much,
Thank you.
Steve.
Sally Pipes, ladies and gentlemen, here on the Steve Malzberg Show. And we're at that time of the hour where you know what's coming next. It's called Gimme 5. And in this particular Gimme 5, we're going to take a look on the comments made by Bill Clinton in response to the comments made by Hillary Clinton and what was said on Meet the Press. So don't go away. It's all next on the Steve Malzberg Show right here on Newsmax Television.